The topic for today: how do we handle the poor for health care? There's actually not a lot of choices. One, we can ignore them, let them die, don't take care of them. Second, we can do, a half-assed job, go back to our previous system where those without health care, when they're getting close to dying or something, they can go to the emergency room and they'll patch them up. They're not going to do open heart surgery for them, but they'll give them oxygen and get them through the heart attack and tell them they need to do something about their heart. The current system, Obamacare, for the states that chose to take the Medicaid extension, we subsidize the poor and help them get Medicaid, and it gets most of their basic treatment taken care of. And I really see that's about the three choices we have. Now, in the first one, where you completely ignore them and just let them die, that's pretty cheap for the rest of us. You have to ask yourself if that fits with your value system, but that's the cheapest. Doing it half-ass, well, I'm not really sure that's cheaper, but it kind of postpones things. It only gives them the kind of health care, get them good enough to put them back on the street again. It doesn't, for instance, if they're diabetic, it doesn't pay for their insulin, or if they're a mental patient, it doesn't help them get any of their meds. Of course, they can check into jail and get that taken care of by doing some petty crime. Do something bigger and get their meds taken care of for a longer time period. But the intermediate is less health care as it is, like tragic care or something. It's when things get really, really bad. And I think that's what the new Trump care is going to do. It's going to move more people back to this half-assed state of going to the emergency room. Of course, that costs money and drives up the cost of insurance for the rest of us. So there's no free lunch. And then we have Obamacare, where we are now, where that's subsidized in mostly Democratic states, and Republican states, they just go back to the emergency care model. So we have the ignore them, half-ass it, or Medicare. Of course, we could start thinking for all of our healthcare system, start being more preventive, more thinking this is health care. How do we be healthy? How do doctors help us be healthy, instead of treating illnesses when they arrive? We actually help people be healthy. That's the way a lot of the rest of the world does it and gets better results than us. Of course, we can look at the winners of the present system, and they've got a lot of damn power. Insurance companies, they do all right. They do all right with the half-ass or the Obamacare system, basically the Medicare system, or the half-ass system, or they ignore the system, because they still in business. They're a middleman. They take from customers who need health care, pass some of that money on to the people that give the health care, and then they keep the money in the middle. They've got a formula. They've got the elite on their side, because they are the elite. So they're the winners in our system. The other winners in our system are the drug companies. In any other field of business, if you sell cheap overseas, then you're charged with dumping. Like if Chinese make steel and they sell it for $10 in China and they sell it for $5 in America, that's called dumping. Well, in the medical business, for some reason, that's not dumping. Pharmacy companies charge us in the United States a truckload for the medicine, and they sell it cheaper overseas. They dump overseas, and we say that's okay. Well, it's a hell of a deal for the pharmacy companies. They can get the volume by overseas, they can get the high profit margin inside the United States. So we got two big winners in our system. Pharmacy companies and the insurance companies. We have one other big winner. If you're rich, you want the best possible medical care when you get sick, right? Well, I'm convinced for rich people, America is the place to be sick. Or six, either. You can get the best medical treatment in the world if you've got money in the United States. So, our system's kind of like most of what America is becoming. Same way as education. It's a great place to get an education if you're rich. Otherwise, it's a great place to get, $100,000 in debt to get a college education where you can actually make a living. So, medicine is just an extension of the theme that America is for the rich. It no longer is a land of opportunity and a place to move up the food chain. In America, if you're born at the bottom of the food chain, likely you're going to stay there or go down. It wasn't always that way. In my day, it was good. You could go up the food chain, and I did. I'm kind of sliding down it at the other end, but I had my day. Most kids today aren't having their day. We've made the rules that set the system up as it is right now. It's completely arbitrary. Actually, we didn't make the rules. The rich made the rules, and we've gone along with it so far. Kind of like, the kings of France made the rules of how it went until one day it didn't. Anyway, that's for Healthcare 101. Ignore them, half-ass it, Medicare it. Someday we may even get the idea of having health care that focuses on health instead of illness. But that's another talk, another day. This is the Ancient Texan with his humble opinion.